Hello everyone. In this video, we will be studying about cranial nerve functional components. First we need to know about anterior. Anterior is related to basal. Anterior plate is also called basal. A is related to B. Then posterior is also called alar plate. And interior one is related to the motor activity while posterior one is related to the sensory activity. Then now we study the somatic and the visceral components of the cranial nerve. In the somatic means that is supplying the skeletal muscles. We have general somatic afferent, special somatic afferent, and general somatic efferent. Okay, in the special somatic there is no efferent. So general somatic afferent. General somatic afferent GSA, it is sensory and it contains sensory nuclei of trigeminal nerve, that is chief nucleus, mesencephalic nucleus, and spinal nucleus, CMS. Then we have special somatic afferent. Special somatic afferent. Special is related to smell. Like we smell these special things like rose, and we hear these special things like someone is telling something special to her love partner. So that is so smelling and hearing is special somatic afferent. And smell, first nerve, olfactory nerve, and eighth nerve. Hearing, eighth nerve, vestibular nerve or cochlear nerve, vestibulocochlear nerve. So first and eighth nerve is special somatic afferent. Then we have general somatic efferent. General somatic efferent are related to eye muscles and related to the tongue. Tongue is a journal thing, eating is a journal thing, and seeing is a journal thing. Smelling and hearing is a special thing that we need to remember. So, what are the nerves related to seeing or ocular vision? That is 3, 4, 6. Oculomotor, trochlear, and abducens. And what is related to eating? Hypoglossal nucleus. Then we have visceral. Visceral means related to viscera or organs. In that we have general visceral afferent and special visceral afferent. These two are similar. These are not separate as it was in somatic. Here GVA and SVA, both the afferents are similar, and it is related to NTS, nucleus tractus solitarius, and from the N ninth nerve, from the T 10th, and from the S 7th. So, what are the components related to general visceral afferent and special visceral afferent? 7, 9, 10. Nucleus tractus solitarius. Then we have general visceral efferent. General visceral efferent is related to parasympathetic. Parasympathetic supply will be coming to the viscera and it will be supplying the general sensations. So that is related to GV. And what are the nerves? 3, 7, 9, 10. As it is in the coagulation factors 2, 7, 9, 10 extrinsic pathway. Okay, so here it is 3, 7, 9, 10. And 3 is a Dinger-Westphal nucleus, 7 is superior salivatory, 9 is inferior salivatory, and 10th is vagus. A Dinger-Westphal, superior salivatory, inferior salivatory, and vagus. Then we have special visceral efferent. Special visceral efferent, that is related to special visceral efferent is only in the visceral part. There was nothing special efferent in the somatic part. Okay, and in the visceral, what is that related to special visceral efferent? Brachial arch muscles. And brachial arch muscles we know 5, 7, 9, 10. 5 masticatory nucleus or mandibular nerve. Then 7 is facial nucleus. Ninth, 10th, and 11th. Here 11th is also there. Okay, in the brachial arches we have not studied 11th nerve, but 9th and 11th nucleus is coming, and that is nucleus ambiguous. So here 7, 9, 10. 7, 9, 10 is included in all the visceral components. Now let's quickly revise again what were the components or the nuclei in the somatic and the visceral. In the somatic, general somatic, 5th nerve. Special somatic, that is 1st and 8th, olfaction and hearing. Then general somatic efferent. General somatic efferent, eye muscles and tongue muscle, 3, 4, 6, and 12th. Then is visceral. Visceral, general visceral afferent and special visceral afferent, that is nucleus tractus solitarius, 7, 9, 10. Then we have general visceral efferent. Efferent is parasympathetic and that is 3, 7, 9, 10. And Dinger-Westphal, superior salivatory, inferior salivatory, and vagus. Then we have special visceral efferent brachial arch, that is 5, 7, 9, 10, 11. Then next we have this, we don't need to remember. If we remember the previous table, then it is okay. Then now we see third nerve. Third nerve is having the journal somatic efferent as well as the journal visceral efferent, parasympathetic also. Fourth nerve is only journal somatic, okay, eye muscle. Sixth nerve also similarly only journal somatic efferent. Seventh nerve all the visceral ones, and ninth nerve all the visceral ones. Tenth nerve all the visceral ones. Eighth nerve, that is hearing, special somatic efferent. And ninth and 10th also have general somatic afferent. Okay, these is not discussed in the previous, this we need to remember. GSA is also there. Then 11th, special visceral efferent, that is related to brachial arches. And 12th is general somatic efferent, that is related to tongue muscles. So this we don't need to remember separately. If we understood the previous part, then it is easy to remember. Then what are the characteristic features? Olfactory or first nerve enter the cerebrum directly without synapsing in the thalamic nuclei. Okay, olfactory nerve will not synapse in the thalamus. Then trochlear. Trochlear is the smallest and slender, fourth nerve, and emerges from the dorsal aspect and immediately decussates with the nerve of opposite side. And it is the longest intracranial course. Then trigeminal 5 is the largest, and sensory root pseudounipolar neurons in the trigeminal or Meckel's cave lateral to the cavernous sinus. It will be lying lateral to the cavernous sinus. Then abducens nerve. Abducens nerve will form the facial colliculus. If we see, then it is formed by the facial nerve. But if we see the nucleus beneath it, then that is abducens nerve, and it passes through the Dorello's canal and at the petrous apex, and in the cavernous sinus it will be lying medially. Trigeminal will be lying laterally while it will be lying medially, and involved in increased ICT, spinal anesthesia, and it has longest intradural course, means in the dura it will be running the maximum course. And facial is most common paralyzed, and it is longest intraosseous. So longest intracranial. In the cranium, longest is trochlear nerve. In the dura, longest is abducens nerve. And in the facial is longest intraosseous. So trochlea, C, after C, cranial from C, then dural from D, and then is osseous. C is come, then after C D comes, and after D O comes. Fourth, sixth, and seventh. That is. Then next we see which are the sensory and the motor nerves, that we see briefly. So that is the mnemonic. Some say marry, money, but my brother says big brain matters most. So first is sensory, second is sensory, third is motor, fourth is motor, fifth is both, and sixth is motor. So 3, 4, 6 we know motor for the eye, and fifth is both. Then ninth and 10th. Then seventh is also both. Okay, eighth is only sensory, and then ninth and 10th also both. And the 11th is only motor, and 12th is only motor. So what is the mnemonic? Some say marry, money, but my brother says big brain matters most. Remember that. Then we see the anterior 2/3 of the tongue's sensations will be by the trigeminal, taste by the facial nerve, and then we have posterior 1/3, both taste and sensation by the ninth nerve. Then carotid body is related to ninth nerve, and aortic arch, chemo, and baroreceptor are related to 10th nerve. And midline in the uvula, that is also due to 10th nerve. Then we see the reflexes related to the cranial nerves. So accommodation reflex and pupillary reflex, both are afferent is second nerve, that is optic nerve, and efferent is third nerve. Then corneal reflex, afferent is fifth nerve, nasociliary, and efferent is seventh nerve, orbicularis oculi. And cuff reflex is 10th nerve, gag reflex, gag ulti, that is related to ninth nerve, and the efferent for both is 10th nerve. So cuff is due to 10th, gag is due to ninth, and both efferent is 10th. Jaw jerk is 5th nerve, third component, that is masseter, and lacrimation is 5th nerve, first component, and 7th nerve is efferent. Jaw jerk both afferent and efferent, 5th nerve. Okay, V3, and here V1 and V7. So that's all we need to remember about the cranial nerve, their functional components, whether they're sensory or motor, and reflexes related to that. I hope you will find it useful. If you like my content, please do subscribe my channel. Thank you.